hello, everyone. It is Tuesday, April 21st. This is Dr. D. This is Q&A with Dr. D. I'm answering all of your questions. Today, we are talking about sciatica and hip pain. The question of the day, let me just get IG set up here. Let's see. Hey, Tamika, how are you? Just getting things set up here. Bear with me. There we go. You should have a pinned comment at the top. And today's question, guys, we are talking about hip pain this week. And our question is, can sciatica be helped or be felt as hip pain? Who else is on? 𝘿𝙧 is on. All right, guys. So to answer this question, we have a couple of things that we need to understand. First of all, we need to figure out what is sciatica, okay? And this is something or a term that you guys may have heard numerous times in terms of referring to pain in the hip. But we need a little bit more of a definition of exactly what sciatica is. Hey, 𝘿𝙧, how are you? So, definition of sciatica, guys. There are a couple of there's one description of what sciatica is. There's several causes of what can cause sciatica. Sciatica basically is a description that we use in the medical community to describe pain that shoots down from the hip, usually down the back of the leg, all the way down into the calf when things get really, really exciting. Okay? There are several causes of sciatica. It can come from a pinched nerve, it could come from a herniated disc in the lumbar spine, or it can come as a result of muscular compression on the muscles around the hip. True sciatica is really an inflammation of the sciatic nerve. The sciatic nerve starts in the hip joint. It's one of the big primary nerves that starts all the way from the lumbosacral plexus, or basically that area where the spine ends and shoots out and starts going into the legs. So that very, very big first nerve that kind of shoots out from that area, from your lumbar spine, from the bottom of your spine, and feeds down into your lower extremities or your legs, that big nerve is called the sciatic nerve. So true sciatica is really an inflammation of that. Sciatic symptoms is usually a description of a combination of things: pain in the hip, shooting pain down the leg, and can have, as I said before, several different causes. It can be from a compressed nerve. It can be from a herniated disc that comes higher up in terms of location in the lumbar spine, or it can come from, again, as I said, direct inflammation or compression of the sciatic nerve, causing that inflammation. How does sciatic nerve or sciatica look like? Sciatica usually looks like a lot of pain in that area, in your butt area. Patients usually have a lot of pain with sitting, or we're doing specific positions that are going to cause additional compression on that nerve. Very typical is what we call a dermatomal pattern, which is or a myotomal pattern. We have numbness and tingling down the back of the leg, or sharp shooting pain down the back of the leg. And that tells us that it's kind of following the pathway of the nerve. Okay? Now, let's get back to our original question. Our original question is, can sciatica be felt as hip pain? So the short answer to that question is yes. Sciatica can be felt as hip pain. Sciatica, because that sciatic nerve is located in the hip, you will find that some people usually will primarily complain of hip pain. But as I said before, it can get more involved and start shooting pain all the way down to the back of the leg. You could have pain with sitting, when you're bending, when you're in a crouch position for a prolonged period of time. You can start really getting what we call sciatic symptoms. So that's kind of the lowdown on if sciatica can be felt as hip pain. Again, to give you a summary, you have to figure out what sciatica is. There's several different causes of sciatica, but the baseline is that it is inflammation of the sciatic nerve. And then because of the location of the sciatic nerve in the pelvis, it can be felt and manifested as hip pain. If you guys have additional questions for me regarding sciatica, hip pain, or any other questions, please drop it in the comments. I'm talking to the guys on IG, Miss Tamika and Miss 𝘿𝙧, or anyone else that comes on. Feel free to drop your questions in the comments. Give me a heart if this makes sense, or comment live if you're commenting live. But guys on Facebook, what do we have? Let's take a look. Guys on Facebook, I see 4 people are logged on. If you guys have any questions about hip pain, or any questions specifically about sciatica, what does that term mean? How does it apply to you, or anything specific around that, please drop it in the comments. Let me know what you're thinking. And I'm going to check back with IG one more time. Seems we are pretty quiet today. I feel like I get comments after I have all answered the questions, and you guys come on after and ask me questions, which is fine. So I hope that was really helpful for you guys. Oh, I do have a question from Miss Tanika. Let's see. What can people do to help relieve the pain? Does it require surgery? Can someone return back to their normal activities? Let's start with the first question. What can people do to relieve the pain? So, again, Tamika, to answer that question, the best way to answer that question would be to first determine what's causing the pain. Is it a compressed nerve? Is it a herniated disc? Is it muscular tightness that's compressing the sciatic nerve and causing it to be irritated? You find that answer out, and then you're better able to figure out the thing that you need to use in order to relieve the pain. For example, with a herniated disc, depending on the severity of that, you will need a little bit more medical intervention and direct conversations with your physical therapist and your orthopedist about the best way to handle that. It's a little bit more of a sensitive nature, specifically if it's a huge herniated disc. In terms of nerve compressions, there are lots of exercises that you can do to unload that nerve. When we talk about a nerve compression, we're actually really talking about a mechanical compression. Usually that's the case, meaning that there's one side that's being compressed more than the other, and that's reproducing the sciatic symptoms. So in that case, you really want to go into the direction of what can we do to unload that nerve. Sometimes it may be movements that help to actually mechanically unload it. It may be stretching exercises. It may be mobility exercises. It all depends. And I'm giving you the big general bucket terms that can actually help with these situations, not specific stuff, because it's a little bit getting into the weeds. In terms of sciatica, does it require surgery? No, sciatica typically does not require surgery. But again, it comes back to what's the cause of it. If it is a huge herniated disc component that cannot be fixed with conservative methods, your surgeon or your orthopedic surgeon doctor may recommend that you do have surgery for it. It all depends on what the problem is and how severe it is. Has more conservative interventions helped you or not? Or is it something that needs a surgical intervention? Usually we go conservative first and then go into the more involved surgical interventions. If the more conservative, we start with conservative, sorry, and then we go into surgical. It all depends on how serious your issue is. And then, can someone return back to their normal activities? Absolutely. Sciatica is a very, very common condition that happens. Many people experience this over the course of their lifetime, along with some sort of onset of back pain. Almost 60 to 70% of Americans are going to have some sort of back pain in their lifetime. This is a very common condition. Sciatica is kind of linked into all of those things in terms of causing back pain because of the depending on the origin. So can you return to your normal activities? Absolutely. You will again require to really identify exactly where the cause is and really be diligent in terms of taking one thing at a time to make sure that you're knocking out all of the things that are affecting you so that you can get back to your full activities. We have worked personally with from very sedentary people who don't, not a very active, all the way to very athletic people who have had sciatic symptoms and have been able to really respond and get back to their life. So there is hope for you guys if you are looking at that. Yes, you can get back to your full life and your normal activities. Okay. So first things first, in terms of looking for the best treatment for your sciatic pain, guys, if you are experiencing this, find out the cause. That's number one. Speak with your physical therapist or your orthopedic surgeon. If you do have access to your orthopedic surgeon, chances are you have access to your physical therapist more. Find out the cause. What is causing your sciatic pain? Okay, let's narrow that down. That's the first thing that you need to do. Second thing, go through the conservative measures first. Okay, physical therapy is one of them. Stretching and exercises is one of them. Low-level modalities in terms of heat and ice and all that fun stuff is another thing that you can do. Hey, Sharice, how are you? Is another thing that you can do in order to calm those symptoms down. If those don't work, then you elevate and you go to the next level. So then you're talking about any medications that you would be able to take, any injections, depending on how severe your symptoms are. That would be the next level of conservative treatment. If all of those things don't work and you've done some imaging, meaning x-rays, MRIs, you've consulted with your orthopedic doctor, and none of those things work, then you're really looking at a surgical intervention. And rarely this is the case if it is truly a musculoskeletal issue, unless there's some sort of heavy pinched nerve or herniated disc causing some compression of the nerves in the lumbar spine, chances are you are not looking at a surgical intervention for sciatica. So that's the progression of how you would really try to intervene here and make sure that you're turning around these symptoms. Okay. Hey, Sharice, how are you? If you have any questions about sciatica or hip pain, drop it in the comments. I'm going to look on Facebook and see what we got. Do we have questions here? I don't see anything. If you do have any questions, guys, we're going to hang out for just about a minute more, see if you guys have anything that you want to ask me about sciatica. If you've had it, have you had it before? Do you know someone who has suffered with sciatica before and it's been crazy and they really needed help? Myths about sciatica, things that you want to do, things that you do not want to do with sciatica. Tell me what you're thinking of. Tell me your questions. I am here to answer your questions. I'm going to look at IG. Tamika, great question. Thank you for asking that question. Any other questions for the guys that are online? Drop it in the comments for me. I'm going to check Facebook one more time. And that looks pretty clear. All right, guys. So I hope I answered all of your questions about sciatica. I will be here back again tomorrow, talking more about conditions of the hip and all of the burning questions that people ask me all the time. I'm just going to pick a question and answer. If you have a question that you want me to ask you, let's see. 𝘿𝙧, what's going on? Kickboxers who get kicked in the legs. So it depends. Give me some more context here, 𝘿𝙧. Are we talking, what part of the leg are they getting kicked in? And exactly what is your question that you want me to answer? Tell me more about that. But yes, guys, if you have specific questions that you want me to answer, drop it in the comments. If it's something of a personal nature, shoot me a message so I can answer your question. I am all here to answer all of your questions. 𝘿𝙧, give me a little bit more context on that. Kickboxers who get kicked in the legs. Tell me more about what you're asking me. Tell me more about location. What part of the leg? Is it the front of the leg? Is it in the back of the leg? Tell me a little bit more about where you are talking about. We're going to wait a little while here for 𝘿𝙧 to give me an answer. Hopefully you're still on, sir. Yes. Okay. So a guy got kicked on the outside of the left leg. Didn't see him in a while, and he came back in a very small leg thigh. Okay. So if you get kicked on the outside of the legs, 𝘿𝙧, I would say that it's possible that it may be a sciatic issue. The probability of that is a little bit low. And the reason for that is that there's a traumatic incident that is identified. The sciatic nerve runs in the back of the pelvis, not on the side. So by location, confirmed as in it was confirmed that it was sciatica. I'm just reading as we're going along here, guys, for you guys on IG. Was it confirmed that it was sciatica? We always kind of try to look at the mechanism of injury to kind of determine what structures can be or possibly affected. Confirmation or specific confirmation of that will, yes, he says yes. Specific confirmation of that will come, of course, with a medical examination, any sort of imaging in terms of X-rays or MRIs. MRIs probably would be indicated in this situation. So it seems 𝘿𝙧 that you're saying that the guy got kicked on the outside of the left leg and didn't see him for a while. And I'm assuming by leg you mean thigh. But it was confirmed that he did have sciatica. That may be, it may be that his sciatic nerve got some injury there. I would be curious to see if he had some sort of things going on higher up in his lumbar spine. If he came back and when we start looking at smaller legs or loss of muscle mass, we're looking at true atrophy. And usually that doesn't happen in the thigh without there's some sort of compression of a nerve. So my concern there is if that was truly sciatica, if that sciatica was being caused by something that's a little bit higher up. I hope that answers your question or your comments. Thank you. But yes, guys, so yes, as T says, probably not about derangement, agreed. Traumatic stuff usually doesn't produce sciatica. And if there's some sort of atrophy going on, chances are there's some sort of nerve compression going on, which we're talking about some sort of what we call a lumbar derangement or an issue with the lumbar spine. Thank you for that comment, Wade. So yeah, so that's what we have going on, guys. Traumatic presentation of sciatica is not particularly common. It's not impossible, but it's not the usual presentation. It usually presents as insidious, meaning it just, you wake up and you're like, oh, what happened? Can it happen? Yes. Does it happen frequently? Not so much. All right. So thank you for that comment, Wade. That was great. I'm going to check in with IG. What do we have, guys? Any other questions for me, guys, before we log off? Tomorrow I'll be here again answering more questions. All right. I think everybody is good. You know where to find me if you do have additional questions. Tomorrow, again, we're continuing all the way through the end of the week with questions about the hip. So if you have specific questions or scenarios like 𝘬𝙧 did a great, had a great scenario of something that he saw and you want to talk about it and get more insight into it, I'm happy to talk about that. It's always good to talk about. It makes it a little bit more real when you have an actual person that you can refer to, be like, this can happen in this person because you've seen it. So happy to talk about that. If not, guys, I will talk to you guys tomorrow afternoon, evening about more hip stuff. Okay? Tag someone in this. I love the conversation. Let's get talking more about how I can help you with hip problems. All right? Have a good one, guys. Bye.